Alright, ladies and gentlemen, welcome to the IELTS study. My name is Clever PC. You guys have been telling me my videos are so long, so lengthy, so let me try to finish this in just under 15 to 20 minutes. So now let's get started. Oh Lord Father in heaven, we pray that we can review the NCLEX so that we can ace it on test day. Amen. A client with gastroesophageal reflux, by the way, we are under the gastrointestinal system. Number 1, the client reporting acid when lying down at night asks the nurse if there is any medication that might help. Which statement is the nurse's best response? Number 1, there are no medications to treat this problem, but losing weight will sometimes help the symptoms. Number 2, there are several over-the-counter and prescription medications available to treat this. You should discuss this with your HCP. Number 3, have you had any x-rays or other tests to determine if you have cancer or other serious illness? Number 4, acid reflux at night can lead to serious complications. You need to have tests done to determine the cause. What do you guys think is the answer? Alright, without further ado, remember to pause if you think I'm hurrying you, if I think I'm so fast, I think I'm rushing you. So the answer is number 2. There are several OTC and prescription medications to treat this condition. You should discuss it with your HCP. Now, we said never pass the book, but how come this was the answer? First, the client said when lying down, client asks the nurse that they do what? If there's any medication that may help, they feel at pain when they are lying down, or they report acid. What's this? This is GAD. So in order to prescribe, you need to tell the patient to discuss this with the HCP so that the HCP can prescribe meds for GAD, like what are they, like PPIs, proton pump inhibitors. Let's first look at the other wrong answers. There are no meds to, no, they are meds of course, but losing weight will, no, they are no, only, never, always. Stay away from such all-inclusives. Number 3, have you had any x-rays or other tests to determine if you have cancer? Oh, this is not soothing at all. Number 4, acid reflux at night can lead to serious complications. You need to have tests done to determine the cause. No, we are not, this is not our role, and moreover, this is not also soothing. So the best response would be to first give those medications and then go ahead and have those tests done. So the best answer was number 2. Alright, number 2, the nurse on a medical unit has received the morning report. Which medication should the nurse administer first? What's the priority? So here, ABC, airway, all that stuff, Maslow's. So whenever you read what will the nurse administer first, think of what will kill the patient. What's the life-threatening condition? Okay, number 1, pantoprazole to a client on call to surgery. Number 2, calcium carbonate to a client reporting indigestion. Number 3, bismuth to a client diagnosed with an ulcer. Or famotidine to a client diagnosed with a gastroesophageal reflux. This is, what do you guys think is the answer? Alright, the answer to this is number 1. This client is going for surgery and they are gonna be NP or nothing by mouth for hours. Why not give them a proton pump inhibitor, pantoprazole or esomeprazole, omeprazole, all those prazoles? They are very good to do what? To inhibit that gastric acid secretion. Let's first look at the other options. Calcium carbonate to a client reporting, that's not an emergency, you can still take your time. Bismuth to a client diagnosed with an ulcer. Bismuth is an antimicrobial drug, more like an antibiotic, but no way, it's not an urgent. Number 4, famotidine to a client diagnosed with GERD. Oh no, yes, GERD is there, but someone is gonna go for surgery. That's an emergency. Number 3, which statement is the scientific rationale for administering a proton pump inhibitor to a client diagnosed with GERD? Why do we give these PPIs to GERD? What's the rationale of GERD? What's the mode of action of GERD? Number 1, PPI neutralize the gastric secretions. Number 2, PPI block H2 receptors on the parietal cells. Number 3, PPI medications inhibit the enzyme that generates gastric acid. Or number 4, PPI meds form a protective barrier against acid and pepsin. I talked about this area. What's the answer? Alright, the answer is 3, PPIs, and that's the role of PPI. The mode of action is that they inhibit the enzyme. Whenever you hear inhibitor, like proton pump inhibitor, something like angiotensin converting enzyme inhibitor, there is an enzyme that they're inhibiting. So in this scenario, it was number 3. Let's look at number 1. PPIs, they neutralize. These are antacids. Antacids like aluminium hydroxide, calcium carbonate. Number 2, PPIs block H2 receptors. These are H2 blockers like what? Ranitidine, famotidine, famotidine. Then number 3 was the answer. Then 4, form a protective barrier. These are mucosal barriers. Number 4, which statement is an advantage to administering a histamine blocker rather than an antacid to a client diagnosed with GERD? Why is histamine better than giving an antacid? Number 1, antacids are more potent than H2 blockers in relieving the symptoms of GERD. Number 2, H2 blockers have more side effects than antacids. Number 3, H2 blockers are less expensive than antacids. Then number 4, H2 blockers require less frequent dosing than antacids. What do you guys think? Before you guys even think, number 3 is off. Never put money in the NCLEX. Such options just annoy me because it's really obvious. Remember these NCLEX tips, whenever I think of them, I need to look you guys in the face so that you remember it on test day. Alright, ladies and gentlemen, the answer is number 4. H2 blockers require less frequent dosing than antacids. H2 blockers, PPIs, those are given 24 hours. However, antacids, on the other hand, are given 2 hourly because acids are continuously produced in the stomach, so they have to give them often. Whereas for H2 blockers, they just required what? Just every 24 hours. Let's look at the other options. Number 3 is off. Money is off on the NCLEX. H2 blockers have more side effects than antacids. Really? Not really. Actually, that's not an advantage. So it would be like a disadvantage. We are looking out for the advantage. Number 1, antacids are more potent than H2 blockers in relieving the symptoms of GERD. Not really. They are both okay. Both of them can relieve. Actually, the best treatment for GERD is what? Is PPIs. So number 4 is the answer. Alright, number 5. Which side effects should the nurse explain to the male client who is prescribed cimetidine? Cimetidine is what? Is an H2 blocker. Number 1, the medication can cause indigestion and heartburn. Number 2, the med can cause impotence and gynecomastia. Number 3, med can cause insomnia and hypervigilance. Number 4, the med can cause Zollinger-Ellison syndrome. What do you guys think is the answer? Alright, ladies and gentlemen, the answer is number 2, and this is the side or even adverse effects of what? Of cimetidine. It causes low libido and development of what? Of breasts, which is gynecomastia, and then low libido is impotence. If you look at the other options, it doesn't cause indigestion and heartburn. It actually treats it. Number 3, it doesn't cause insomnia and hypervigilance. It's the opposite. It causes somnolence, which is the opposite insomnia, and lethargy. Lethargy is the opposite of hypervigilance. can cause Zollinger-Ellison. No, it doesn't cause Zollinger-Ellison syndrome. Zollinger-Ellison syndrome is hypersecretion of gastric acid, so it doesn't cause this. Actually, it does what? Still, it's the opposite. It manages, it treats it. Number 6, the home health care nurse is caring for male client diagnosed with hiatal hernia and reflux, which data indicates the medication therapy is effective. So what's ADPI evaluation? What shows that the med is working? Number 1, the client takes the antacid 1 hour before and 3 hours after a meal. Number 2, the client reports indigestion after eating a large meal. Number 3, the client states that he didn't wake up with the heartburn during the night. Number 4, the client has lost 3 pounds in the past 2 weeks. What shows that the medication is working for hiatal hernia and reflux? What do you guys think? Alright, the answer is number 3. This is the best because it says that he didn't wake up with the heartburn during the night. This shows that the GERD has done what? Reduced, like the gastric esophageal reflex has done what? Has reduced because there was no heartburn. Let's look at the rest. Number 1, the client takes an antacid 1 hour before. That doesn't show, like, I don't know how to say it. It's not an evaluation, it's actually an intervention. So that's like follow up. That means they're actually compliant with the drug, which is great, but it doesn't answer our question. We want to see if the med is working, not if the patient is compliant with their med. So understanding the question is key. Number 2, the client reports indigestion after eating a large meal. No, that's even worse. Number 4, the client has lost 3 pounds in the past 2 weeks. Not really. Alright, the answer is number 3. Number 7, the nurse is preparing to administer esomeprazole. Which intervention should the nurse implement? Select all that apply. How do we handle select all that apply? True, false, or true or false? Alright, number 1, order an infusion pump for the client. No, esomeprazole is given PO by mouth, so there's no need for a pump. Number 2, elevate the client's head of their bed. Absolutely, because for the patient to take this drug orally, you have to do what? To raise the head of the bed. Number 3, check the client's ID with the medication administration record. Absolutely, you have to confirm before you give this drug to any client. Date of birth, the patient's name, the patient's hospital ID. Number 4, check for any allergies to cephalosporin. Why? Check for any allergies, it would have been okay, but now to cephalosporin, no, esomeprazole is not under cephalosporin, or it has nothing to do with cephalosporins like ceftriaxone, all that stuff. It has nothing to do with those antibiotics. Number 5, ask the client their date of birth. Absolutely very important to confirm whether this is the client. So the answer is number 2, 3, and 5. Alright, number 8, the nurse is discharging a client with GERD. Which information should the nurse include in the teaching? Number 1, there are no complications of GERD as long as you take the medications. Number 2, notify the HCP if the med doesn't resolve the symptoms. Number 3, immediately after meal, lie down for at least 45 minutes. Number 4, if any discomfort is noted, take an NSAID for the pain. What do you guys think is the answer? Alright, the answer is number 2, notify the HCP if this med that's already given doesn't resolve the symptoms. Absolutely. Let's first look at the other options. There are no complications of GERD as long as you take the meds. Oh my god, there are no, only, always stay away from such inclusives. Alright, but obviously there are complications of GERD like esophageal cancer, asthma. So number 3, immediately after a meal, lie down for at least 45 minutes. No, they're actually supposed to be seated for 60 minutes. Seated upright for 60 minutes so that the food gets off from the stomach. Number 4, if any discomfort is noted, take an NSAID for the pain. No, this is now NSAID. They cause what? Gastric or distress. So there's absolutely no need to take NSAID. NSAID is contraindicated in GERD. Number 9, the nurse is discharging a client. Today is post-op hiatal hernia repair. Which discharge instructions should the nurse include? Select all that apply. Patient is being discharged. So number 1, take all the prescribed antibiotics. Absolutely yes. Antibiotics, they should be taken even if the patient feels fine, so that we can struggle with prevent antimicrobial resistance. Number 2, eat 6 small meals per day. Absolutely, these patients from surgery, have pity on them. Number 3, use the legs to bend down on the back. Absolutely, this is an abdominal surgery, so you don't want the patient to bend, rather to squat if they want to reach something down. Number 4, take esomeprazole twice a day. Esomeprazole was okay, but then twice a day, no, it's once a day. Number 5, use the pain med when the pain is at 8. Oh my god, 8 is too much. Use pain when just at the onset. So meaning our answers were 1, 2 and 3. Alright, last one, the adult client recently has been diagnosed with asthma. Which med is recommended to treat this problem? Is it esomeprazole? Is it amoxicillin twice daily, loratadine daily, or prednisone daily? What do you guys think is the answer? Alright, ladies and gentlemen, the answer is number 1, omeprazole daily. Why? Here we have an adult client diagnosed with asthma. So if you give omeprazole is gonna treat symptoms like GERD, which often causes asthma. But if you look at the other options, amoxicillin, asthma is not a bacterial infection. No, it's just a condition. It can be due to GERD, pollen, dust, allergies, all that stuff cause asthma. But then number 2, amoxicillin twice daily, no. Loratadine daily, no, not really. Number 4, prednisone daily, no. Actually, prednisone is a glucocorticoid. It will increase the blood sugar and it will even worsen this. So the best answer was number 1. Alright, this marks the end of our gastrointestinal system. Hope you guys gain something from this short video, and I wish you all the best in your forthcoming NCLEX test. Peace everyone.